Let's say I'm about to go and meet a particular physician and I want to have insights that will tell me and show me how to have a more meaningful conversation with that individual straight away based on what they're currently thinking and feeling. Perhaps I'm visiting a physician in a hospital, or I've seen them at a congress meeting and I want to engage them in a meaningful way with empathy. Now, let's say here I am on the breast cancer dashboard. The beautiful thing about DOL Finder 2 is it runs just as well on your mobile device as it does on your desktop application. So you can carry it with you into Congress, you can carry it with you in the field when you're going to visit physicians. And I've just bumped into or seen, let's say, Dr. Erica Hamilton. So I'm just going to quickly put her name in here and do a quick search. And let's see if she's in DOL Finder. And if she is, then it's going to tell me what is she speaking about, who she connected with, which clinical trials is she engaged with. Here it says, one found. Here she is, Dr. Erica Hamilton. So I'm going to pull up her profile, and I see straight away that I can link directly to her X account, her LinkedIn, to her Blue Sky. I can see her official MPI number. I can see where she is. I get a digital persona here telling me something about how she behaves online, what she cares about, based on the most recent posts that she's posted on social media. Her approachable tone and commitment to educating both peers and patients reflect a deep dedication to improving the lives of those affected by cancer. I can already start to think about ways I can connect with her with empathy. It says that she shares insights and resources. She is actively engaged in discussion about emerging treatments and clinical advancements. So straight away, I start to learn perhaps there are topics that she might be interested to discuss with me. I can scroll down and let's have a look and see who is she engaging. Well, which healthcare professionals are amplifying her? Here we see Sarah Tallaney, amplified her 15 times over the last year. But those that are referencing her on social media, Gil Morgan, 147 times, Matteo Lambertini, 131. So perhaps I want to think about, if I was bringing a number of HCPs together, here are some HCPs who she already knows because they're tagging her so many times on social media. And I might want to think about which recent Congress events has she been involved in. Look at this timeline of her activity. You can see there are some significant spikes. And if I zoom into this, I can now see, right, one of those was October. That's ESMO. One was in December. That would be SABCS. So I can learn about engagement that happened. She posted 10 times during SABCS at the peak there on one day. And she was retweeted 83 times, liked 230. So right, I'm seeing that she was quite impactful during the SABCS Congress. Let's quickly take a look at the kind of hashtags she's using: Med Twitter, SABCS, and then I can come up here and I can see, let's have a look in the conversations that she's posted over the last year. Which products is she talking about? Which topics? And which clinical trials? So I see here she mentioned Patina trial quite a few times. Finally, I'm going to have a look at her sort of sentiment. How's she feeling over time in the breast cancer space? Among her breast cancer conversations, it took a bit of a dip in September. It seems like she was quite optimistic following that, and particularly towards the end of December. So perhaps she's feeling quite optimistic in this space. So straight away at a glance, I get to see so much rich insight into Dr. Erica Hamilton's perspectives on the breast cancer conversation. And I can use that information to, connect with her, hopefully with empathy, meaningfulness, and that's going to inspire a great conversation.